And I have always said that for all the good that the Affordable Care Act is doing right now, for as big a step forward as it was, it's still just a first step. It's like building a starter home or buying a starter home. It's a lot better than not having a home, but you hope that over time you make some improvements.
Like a starter home. President Obama earlier today making one last attempt to promote the Affordable Care Act. And while he made suggestions on how to fix it, he will inevitably become Hillary Clinton. It will inevitably become Hillary Clinton or Donald Trump's problem. Joining me now to discuss, David Morey and Dr. Stephen Reisman. Doctor, it's one hell of a starter home. I got to tell you, millions of folks, the vast majority of folks are paying more for their coverage. Their deductibles are much higher than they used to be. A lot of them have lost their health care plans, and some of them are losing their doctors.
Yeah, it's a disaster, because what's happening is people who used to have affordable plans have unaffordable plans now. People who used to have good coverage have high deductibles. Deductible means your insurance doesn't kick in until you spend $1,000, $2,000, $3,000 out of pocket.
By the way, a lot of people I know, the younger, healthier people, are opting out, paying the fine because they figure out the deductible's so high. I'm never gonna get there, so I might as well just opt out and pay the fine.
It's a big problem, and one of the problems is also that they haven't really attacked the cost structure of health care. The pharmaceutical companies, the insurance companies that are making big profits, the hospitals that charge $30 for a Band-Aid. These are things that have to be gone after, and because of the lobbyists in Washington, I believe nothing's been done about it.
And avoid those lobbyists. David, I understand it's a starter home for the people that didn't have insurance before, and they're getting a good deal, no doubt, no question. People who didn't have insurance now have insurance, God bless them. But the vast majority of people feel like they're getting kicked out of their home.
Well, David, it's good to be with you. I'm going to agree much more than I disagree with both of you. 11.3 million people are now signed up to health care, so that's the good news. There was always supposed to be two parts to this: accessibility, and there has been some of that, and affordability. It's as if we stopped at the last step. You know, usually when you pass these kinds of very big bills, there's a period of adjustment, and we missed that. And anyone who's involved in healthcare, like the doctor or me, I watch my premiums go up for no good reason, understands we've got to completely transform the way we do cost care in this country. It's absolutely got to have a really aggressive second phase. This is not like a starter home. This is like, it needs major reform, almost revolutionary reform on top of the base that's been built.
But Dr. Reisman, a lot of people are saying that what we're going to end up with as a result of that reform, if you want to call it that, of Obamacare is full-bore socialized medicine.
That may not be necessarily true, but we have to look at other countries. There are a lot of other countries in the world that have very successful healthcare systems. Pharmaceuticals don't cost $150, $200 when you go to the drugstore.
But isn't that because they're piggybacking on our success? That is, they're using the pharmaceutical products that we have, waiting until they're generic, and then getting them in their system. We may not have new drugs as a result of what's happened here with Obamacare.
I don't believe that's an issue. I believe we'll always have new pharmaceuticals, and the pharmaceutical companies are taking advantage in the United States of the ability to charge as much as they can.
Well, we've seen that.
Look at EpiPen, look at all these examples of runaway costs. And
EpiPen was not unusual. We have other examples.
Many examples. So I think we have to attack the cost structure. I think, and once you do that, you could look at other countries. Look at,
when you have price controls, if that's what you're talking about, you always have shortages. That's a rule of economics. But David, I want to ask you about whether or not it was a plan. And of course, we know that President Obama, before he was president, was a fan of socialized medicine, of one-payer health system. Is that what we are going into, and was that always the plan, realizing that Obamacare wasn't work and therefore people would default to socialized medicine?
No, I don't think so. I don't think that there's enough of a mandate, no pun intended, for that to happen. I think what has to happen here, remember, President Obama paid a very big price. This bill was passed with virtually no Republican support, and he lost a lot of seats at the state and federal level, more seats than any sitting president. So we've all paid, I think, a non-bipartisan price for the way the bill came down. Let me give you one specific example.
Very quickly, David, we got to wrap. Go ahead.
Real fast. We now don't have the ability to, the government can't negotiate with pharma vis-a-vis Medicare, Medicaid. That doesn't make any sense.
Right. I don't think you have to convince anybody that Obamacare doesn't work. It's just amazing we bought into it in the first place.